When we look closely at the Medicare Advantage star rating program, one thing jumps out. Domains 1 and 2, which deal with preventative care and managing chronic conditions, account for 65% of the total weighting of a Medicare Advantage plan's star rating for their Part C. These typically are HEDIS metrics, and they reflect activities that the health plan is receiving from the primary care physician, services being given to your members. So it's really measuring something that is outside of the health plan's direct control. You're really hoping to make sure that you have documented activities that the primary care is doing for your members. And this gets at the issue that we call the documentation problem. Documentation problem really shows up in two ways for a health plan. First of all, if I retire, I start shopping around for a Medicare Advantage plan, and I sign up for one. Well, if I change health plan providers from A to B, B does not have the benefit of my claims history that health plan A would have. So as a result, they are at a disadvantage in terms of knowing what has been done and what still needs to be done. So there may be apparent gaps in care that aren't really there, but I'm getting downgraded as health plan B because of that. The interesting thing is the primary care does have that data. So if the health plan can find a way to engage the provider and get that information back, that makes a big difference in terms of resolving this documentation issue. Another reason why you need to engage with the provider is related to documentation, and that is around coding. The actual procedure may have been done, but not documented in a way that allows you to reflect it in your HEDIS rating. So as a consequence, you need to go back and capture a level, at least at a pseudo claim, to understand if the actual procedure was done or not. And therefore, you can focus providers in then on legitimate and real gaps in care and get them to focus on that.